Good afternoon, ladies and gentlemen. The webinar is beginning. Welcome. My name is Chris Wilson, the Communications Director here at the Dallas-Fort Worth Hospital Council. Thank you for being here today for this webinar hosted in coordination with InsMed Insurance Agency, an associate member of the Council. Today's topic is no-cost opportunity to address physician and executive benefit expectations. Since 1993, InsMed Insurance Agency has been guiding healthcare professionals seeking to secure insurance protection that addresses the impact an accident or illness may have upon their financial well-being. Today we have Morton Sorensen, Executive Vice President at InsMed, serving as our speaker. Today we will discuss how you can add benefit value to your disability insurance program without cost and without disruption to your current benefits. You have the ability to provide your physicians and executives the opportunity to obtain discounted individual and portable disability insurance coverage without a medical evaluation and without the need for payroll deduction. Morton started his insurance career more than 25 years ago and immediately began working with physicians at a New York City hospital. In addition to his involvement in the operational aspects of the company, Morton works with InsMed's corporate clients and provides insurance advice to leading attending physicians and healthcare executives across the United States. We're looking forward to his presentation. With that, ladies and gentlemen, here's Morton Sorensen.
Thank you very much, Chris. And I assume the audio is still on, otherwise you'll have to yell at me somehow.
Yeah,
thank you very much.
On.
Sorry, go ahead.
Go ahead, it's on.
That sounds good. Thank you very much to all of you for attending here. Just want to throw out a couple of little tiny bits before I really get started. The presentation is titled Physicians and Executives Benefit Expectations, but in the following there's a chance that I may just refer to physicians, there's a possibility I may use the word providers, and there's a possibility I may just refer to executives, but there's a good chance that it's going to be physicians because we are quite physician-centric, but I'll get to that in just a moment. But please know that if I do stick with the word physicians, it is interchangeable to the more broad executives, physicians, and providers. This program can actually cover some mid-level people and managers as well. So just wanted to mention that. There are technically two programs that I am going to be discussing. It is not necessarily going to be transparent to you whether I'm talking about one or the other. But the reason is simply that the specifics of the offer that we can come up with really depends on the size and the makeup of your specific group. So, for example, we can actually go quite small when it comes to a group size. We can go as low as, say, a group of perhaps 5 people. Not that I necessarily think that there are any particular hospitals that only would have a combination of 5 providers and executives, but we can accommodate a pretty small group. And on the flip side, we can also, of course, go very, very large towards the other end. So we use 2 different companies, you could argue. One is a regular, straightforward U.S.-based company. I'll keep them nameless because technically we could use a couple of different ones. And the other program is really anchored through Lloyd's of London. But those are some more specific details we can get into if necessary. And certainly, once we have a one-on-one conversation about your specific group, then we'll definitely get into those kind of details. So, having said that, let me move on here. InsMed Insurance Agency. As Chris mentioned, we are insurance brokers. We do not work for any particular insurance company. We work for you, and we work for your providers and executives. We work exclusively within healthcare. Disability insurance for physicians and healthcare executives is really about 90% of what we do. The remaining 10% would be some different types of insurance options, but all of it is really within healthcare. Company has been around for a while. We were incorporated back in '93, so we've been around. We have sustained. And as Chris mentioned, I have been in this particular business working exclusively with physicians and healthcare executives for quite a number of years. So there are certain voluntary programs that we can offer. And I'm sure you've all been pitched some kind of voluntary insurance options in the past, but these may be different to the extent that they are specifically geared for your type of population, and also they are guaranteed and they are issued in certain ways that are not commonly available in the marketplace. In fact, some of the insurance companies are quite reluctant to roll these things out because they do require brokers that have a level of experience within both the particular healthcare segment as well as experience with these type of programs. But the key here is that we have some voluntary programs that can be offered on a guaranteed basis, and they will really allow those highly compensated people within an institution, whether they're physicians or executives, highly compensated mid-levels, to more adequately protect their incomes. I'll get into this a little bit more in detail in a subsequent slide, but there are some income sources that are not always covered through an employer-provided group long-term disability program. And this is another reason why these programs have some merit. Of course, having solid benefit programs that you provide in addition to this stuff here is really what will help attract and retain employees. But having a strong voluntary guaranteed disability insurance program can actually also be a factor in attracting key employees for the institution. We work with a lot of residency programs, and many times we come across people who have health impairments. And one of the things that we will tell those physicians is that when you're looking for employment, not only do you need, of course, to find a job that will offer you the income and the other things that you're looking for, but because of your specific health situation, it may be important for you to look specifically at employers that not only have great disability insurance while you're there because of your health situation, but also perhaps a program or an employer that will offer you an additional level of disability insurance that you can obtain while you're there, and perhaps equally important for that particular type of employee, something they can retain if they were to leave that employer at some point in the future. The coverage we are offering will be offered on a voluntary basis. It comes with some discounts and some underwriting concessions, mainly the fact that there will be no medical evaluation involved. And this coverage is portable, so if somebody obtains it, they can maintain it should they leave employment at some point. And a key aspect of it is that this coverage is not involving cost from your end of the program. It is there's of course no such thing as a free lunch. We will take some of your time. We will have some discussions. We will request some information from you, but there is no dollar participation on the part of the employer. So if we look at a group disability insurance program that is provided by an employer, number one, you set the income replacement level in terms of a percentage. Frequently, it's pegged at 60%. So if one of your employees became disabled, 60% of their salary will be replaced through the group disability insurance program. Now, there's also a monthly maximum on the group plans, and that monthly maximum is also set by you. And for the highly compensated people, this particular aspect of the coverage really becomes important. For example, if you have a group plan with an income replacement percentage of 60, but it has a maximum payout of $10,000 per month, you're effectively only covering up to $200,000 worth of annual earnings. And some of your physicians and or executives may very well exceed that level, which means they will need some other source to protect their incomes. When an employer provides the coverage, depending on the setup, but in most cases, the benefit is a taxable benefit. So that will further reduce the net benefit to the employee. And lastly, the coverage is usually not portable. There are some times that a group plan may list some portability aspects if somebody leaves the institution, but there are a number of ramifications that people don't always take into consideration. Typically, the parameters of coverage will change. The pricing is usually different from what the employer pays for that coverage, and sometimes the availability of that coverage will be limited depending on any disability benefits provided through a new employer. So usually group disability, although it contains typically a portability or a conversion aspect to it, it is usually not something you can rely on if you left the employer. So if we look at some of these issues that I just mentioned from a numerical perspective, starting out here, this is obviously a simplified scenario, but looking at somebody who's earning $200,000 per year, using a 28% tax rate, the net income for that individual is $144,000 per year. If that same person became disabled and had a group plan that replaced 60% of income, the gross payout from the group plan is $120,000. Because the employer provided that coverage, it is taxable as income, and using the same 28% tax rate, that will bring you down to a net disability benefit of just over $86,000 per year. So clearly going from $144,000 of net earnings down to $86,000 of net earnings, that's the kind of stuff that will really impact your standard of living. So what we can do with these types of programs, we can layer in an additional level of disability coverage on top of the group plan already provided by the employer. And depending on the scenario, depending on incomes, in this particular case, we are showing an example of adding an additional $30,000 per year of tax-free disability benefits. That particular portion of the coverage becomes tax-free because the employee pays for the coverage with after-tax dollars. And I should probably throw in a caveat stating that I'm not allowed to give tax advice. So that's about the extent of my tax advice, doing a little bit of math and stating that a benefit that is paid with after-tax dollars is a tax-free benefit. So again, some of the advantages of this individual coverage is that we can bring up the income replacement to as much as potentially 75% of income, and that's looking at 75% of the gross earning of the physician or the executive. Benefits are tax-free, which further helps to offset any of the other shortcomings in the other disability coverage benefits. We coordinate this with the benefits that are already provided by the employer, and depending on the type of program, we could conceivably come up with as much as $100,000 per month benefit. Depending on the situation, et cetera, there are sometimes we run across some healthcare executives and some specialists that make well in excess of $1 million per year. And in those cases, we can come up with some pretty substantial monthly benefits. We may sometimes have to use a few different sources, but the limits are pretty high. One of the things that's really important, especially to physicians, is that the coverage is specific to their specialty. And these plans that we offer through here will have an own specialty or an own occupation definition of total disability for the entire benefit period. When it comes to looking at income sources, one of the reasons employer-provided disability benefits aren't always sufficiently covering the incomes, it has to do with how those incomes are structured. It's very common that a group disability insurance plan only covers basic earnings. It does usually not include performance-based compensation. And many times it does not necessarily take into consideration anything that is being set aside for a retirement plan. Through these programs, we can cover pretty much any income source and use that to bump up the level of coverage. The coverage is offered with discounted, gender-neutral rates. If you go out in the open marketplace and want to obtain disability insurance, men and women do not pay the same rates. If you look at morbidity tables, you'll see that women have a much higher level or much higher occurrence of disabilities, and therefore the insurance companies are allowed to charge them more. So women pay quite a bit more for disability insurance if they have to go out and obtain it in the open market. Under these programs, those gender-specific rates have been dropped down to a gender-neutral rate and then further discounted. So it offers really a savings for everybody who participates but women in particular will really benefit tremendously from a financial perspective if they participate in these kind of plans. Once this stuff is implemented, the offer is exclusive to us. And the reason that may be important for you is simply that you will not have a whole bunch of different insurance agents in your institutions trying to pitch this particular offer or similar offers to your employees. We are the only ones that would be able to provide this through that particular offer. I mean, obviously, we can't keep out a bunch of insurance people. I'm sure there are people that will pitch you and your employees stuff all the time. But at the very least, this is an offer where you don't have to worry about who is offering this and who's in here pitching this particular offer to our employees. So getting into a little bit more of the specifics on the program, it is a guaranteed issue program, which means there are no medical evaluations necessary. Even physicians, providers, executives who have current or pre-existing conditions, people who have otherwise in the past been turned down for disability insurance or who have ended up with exclusions on their policies, they are guaranteed access to coverage through this particular offer. It is individual coverage that has an own specialty-specific definition of disability, and we already spoke a little bit about the limits. I just listed 25 here just to keep it easy. There are several different features we can build into one of these offers. In some cases, depending on the size of the group and depending on the specific offer, sometimes we have to make the offer uniform for everybody. So we will take a discussion up front and say which particular features should we include in this offer, what would probably be of interest to my particular employees. For some of the other programs, depending, we may come up with, for example, 3 options and say, well, these are the 3 options we're going to offer to the employees. So option 1 may include these 3 different options. Option 2 may include these options. And then there's going to be a third option that will include some other options. So again, the following features, I'm just going to list them very quickly. They really will depend on the specific situation. And lastly, it will depend on the conversation we have and what you find to be of importance to your people. So one is the lump sum benefits. I will cover that in just a little more detail in a moment. There is an inflation protection we can build in. We can set up the coverage to protect retirement plan contributions separately from regular disability coverage. We may be able to build in some student loan protection. So if you, for example, have an institution where you have hired a lot of residents and fellows, for example, or you have a lot of people who are fairly young, there's a good chance that they may have some student loans, and we can go in and protect those loans separately in the event of disability. We can build in catastrophic coverage, which will offer an additional payout if there's a catastrophic disability. We may be able to offer a transplant benefit, which is something that may not really be used much, but it is a feature that would allow people who, on a voluntary basis, decide to become a transplant donor. They may be able to have that covered. There is some additional features here. I'm going to skip pretty much quickly over those and get into participation. So when I mentioned before that we can go down to as few as 5 lives, that means that you must have a group of at least 5 eligible people. If we do that, then all of those 5 people must participate. Otherwise, we may look to a slightly higher level of participation. We may look to we would require at least 10% of your population to participate. The reason I'm mentioning participation is because this coverage involves guaranteed issue. The insurance company is always concerned about people who sign up for coverage and have knowledge of some pre-existing condition. So in other words, if you have, for example, 10 employees and 3 of them have pre-existing conditions, there is, of course, a greater likelihood that those 3 who know already that they have an impairment and a greater likelihood of becoming disabled, that they will, of course, go out and buy insurance. So that type of scenario is referred to as adverse selection, and the insurance company is concerned about that. So in order for them to come up with a guaranteed issue offer and spread the risk, so to speak, they want a certain level of participation. So in one scenario, it is the greater of 5 lives or 10% participation. For one of the other programs, we're really looking for a target of about 20% participation in order to keep the program alive. So, of course, there's a basic component of the coverage. It's an individual policy. Benefit up to 25,000, could be even higher. No medical underwriting requirements, specialty-specific definition. We can, between what you already offer and what we can come up with through this program, we may be able to replace as much as 75% of pre-disability earnings. Depending on the program, we can set benefits up to start after 90, 180, or 365 days of disability. And depending on the program, wishes, etc., we can set the coverage up to pay out for example, a 5-year payout period. More commonly, it will probably be up to an age 65 or age 67. So in other words, if somebody became disabled and remained disabled, the payout can go on until Social Security retirement age. Depending on the plan, some of the policies will have a 5-year coverage term. Others will have a term of coverage that will run until the age of 67. If we're talking about the 5-year coverage term, that really means that the coverage will be renewed and the rates may change after 5 years. It's still going to be guaranteed issue. Nobody's going to be turned down after that 5-year period, but the rates may change. For the other type of program where I've on the screen have noted non-cancelable to age 67, those policies, once they're issued, the rates and the parameters of coverage are locked in contractually until the age of 67. So that, again, becomes a little bit more of a one-on-one conversation once we get to your specific program to find out what is available, given my size and my makeup of my group. As I mentioned, the policies will have gender-neutral rates, and the discount may be as high as 30%. And so the 30%, as I mentioned, on top of neutral, gender-neutral rates, for a woman means that you would probably be saving closer to as much as potentially 40 or 50% compared to what she would pay in the open market. If somebody already has a policy, the amount of coverage available through the offer may be impacted by that individual coverage. So in this case, if somebody already has bought a lot of disability insurance, they may not be eligible for the full amount of the coverage that's otherwise available through the offer, simply because the insurance company want you to have some level of an incentive to go back to work in the event of disability and as you start recovering from that disability. I mentioned before that one of the features we may be able to put into these policies is a lump sum benefit. And it's a benefit that may appeal to especially executives and high-income earning physicians. If there was a really severe disability that would mean a career-ending disability, conceivably we could come up with as much as $10 million as a lump sum payout in that scenario. And that's a payout that would be paid out in addition to the regular ongoing disability coverage. In order to qualify for that type of a payout, somebody would have to be disabled completely from the occupation they're engaged in, and further, it's not expected that they would ever recover from that particular disability. One of the options under one of these plans here is retirement contribution protection. Basically, what we can do in that case, in addition to the regular disability benefit that will cover the ongoing monthly earnings, we can say, if you became disabled, even though we are maxing you out for the amount of coverage that you can get, we can set you up with a separate benefit. Actually, the 4580 may be slightly outdated because it may be a little higher because it really follows the maximum amount of IRS contributions into, for example, a 403B. But we can replace on a dollar-for-dollar basis any retirement plan contributions in the event of total disability. People who are totally disabled can no longer, per the IRS, contribute to a qualified plan. And a lot of people really neglect to think about their retirement plans if they became disabled. If you have, for example, a 40-year-old physician who becomes disabled and has a disability that lasts for the duration of his or her otherwise normal career, the lack of funding into a retirement plan from that early age will really have a very, very significant impact on the amount of funds that are available at the age of 65 or 67 when the regular disability benefits stop. So funding for retirement is really a neglected part of disability insurance coverage. The other aspect I want to mention of this is we run into a lot of, especially the highly compensated specialists. They want to buy as much disability insurance as they can, but they run into some artificial limitations imposed by insurance companies. And the issue becomes they may make, let's say, $800,000 per year, but they really cannot get anywhere near that amount of coverage through the regular disability benefits that are available in the marketplace. In those scenarios, ensuring this extra retirement plan contribution really allows people to almost circumvent the artificial limits and get to a higher level of income replacement. And the benefits from this particular type of coverage is actually paid out into a trust. It's one of the reasons why the insurance companies will allow people to have this higher benefit above and beyond the regular limits, because the physicians or the executives cannot get their hands on the funds until they reach the age of 65. There's not a lot of taxation of the money going into the funds, but because it is not a qualified plan, any taxable events that take place within the funds in that trust are subject to annual taxation as those taxable events occur. But because they have been taxed throughout the years while the funds have been growing there, it really means that by the time somebody turns 65, any funds accumulated will be paid out on a tax-free basis at the age of 65. Benefits for this particular part of coverage is paid after 180 days of disability, and again, paid up until the age of 65, at which point they become available. Student loan protection. I mentioned before that one of the features we may be able to include is protection for student loans. So similar, in a similar fashion to what I mentioned about retirement plans, even if you get to the maximum levels, we may be able to go slightly above those levels, for example, because we want to protect student loan repayments on a separate basis. So in this case, depending on the situation, we can actually add an extra $2,500 monthly payout that will be earmarked to reimburse any payments a disabled person may have to make for their student loans. And again, it's paid out in addition to the other disability benefits. In order for us to provide the student loan protection, we do not need to get into specifics about somebody's loans. We don't need any documentation for the loans. It's simply a question of that person just stating, I would like to include this in my coverage. The student loan coverage will typically be on a policy for as much as 15 years from the start of the policy. Really not much need to go beyond that 15-year period, because most people will have either paid off their loans within that time frame, or they may be eligible for, at least given current scenarios, some kind of public service loan forgiveness at that point in time. Another feature we can include is catastrophic coverage. We can build in benefits that will pay an extra $8,000 per month in the event of a catastrophic disability. And again, those benefits are paid out in addition to the regular ongoing monthly benefit. In this case, a catastrophic disability, it kind of follows a long-term care definition. It is the inability to perform 2 out of 6 activities of daily living, which would be bathing, dressing, eating, transferring, toileting, or continence. Or if somebody became cognitively disabled, that could also trigger this particular benefit. Again, these benefits, in terms of a payout, they basically follow the regular schedule of the policy. The enrollment process. I'm not going to get into any further details on some of the other riders. This is really more the part that is perhaps of more interest to you. The enrollment process the basic part of it will be a web-based enrollment, which really makes it easy in terms of communication. There will be a specific website set up for your particular institution, and emails will be sent out with login information for your employees or your particular members that are eligible. We can also do this in a paper format, but we usually do that as a backup. In other words, we start out with a web-based enrollment. And then as we get into the web-based enrollment, we see who has logged in and who has not. I'm sure you're well too familiar with people who don't open their emails or don't take action in a timely fashion. So typically what we do after some time has passed and we see that there is a group of employees who has not yet logged in, we typically send them a paper kit to their homes, including basically the same information. Those kits will include various types of service response forms, which will allow them to request any additional information. But also there are times when people, as we spoke a little bit about before, when they have an existing disability insurance policy already, and people start wondering, well, how does this interact with my existing policy? Or it could be a scenario of somebody who already obtained a policy, but on that policy there may be a back exclusion. Somebody may have had an issue with their hand, so there could be a hand-wrist exclusion or some other type of exclusion on the policy. And in that case, people may start wondering, well, am I better off getting rid of this coverage I already have with the exclusion and signing up for this offer instead, or can I possibly maintain both, etc.? So in that case, we get into a one-on-one consultation with those individuals. And of course, we have phone numbers and email addresses to accomplish that. So the basic summary part is really that we can get additional disability coverage for your employees, and we can do that on a guaranteed basis, regardless of pre-existing medical conditions. And we can, of course, put in a lot of features, as I just mentioned, that will not only cover the basic disability, but it can also cover additional payouts in the event of catastrophic disability, and also some specific features for example, retirement plan contributions as well as student loans. And it comes with full portability of coverage. So I know that we have at least a fair amount of time, and I'm sure that an insurance guy discontinuing talking at some point during an afternoon is not the worst thing you can experience. So at this point, since we have plenty of time, I will let you check in with me, Chris, and let me know if there are any questions.
Absolutely. Thank you, Morten. That was a great presentation. A lot of interesting information there. We're going to open it up to questions now. If you look in the panel on the right-hand side where it says questions, just hit that arrow and you can type in the question, and we'll be happy to have Morten answer them for you. So go right ahead. Looks like we have one question here. How does this work if somebody already has their own disability insurance?
So if somebody already has a disability insurance policy already, as I mentioned, we'll have a one-on-one conversation with that person. But let's, for argument's sake, say that the person is pretty much maxed out in terms of coverage. The offer in this particular case, it could be a benefit of $5,000 per month. If somebody already has a substantial amount of disability coverage, they may not be eligible for any additional disability coverage. It could also be a situation where somebody has a lot of disability coverage, but the income is also very high. So they could be eligible for the full amount of the offer. I mentioned $5,000 as an example. And sometimes we may have to tweak it and say, well, the full offer is $5,000 per month, but because you already have this other coverage, we can only offer you $3,000, and that's typically what will be offered. And at that point, we will basically re-quote everything based on the new parameters and the new situations. But we'll have that conversation one-on-one.
Okay, well, we have a couple more here. Who does the work, such as sending letters or emails?
Yes, and one of the, what at least what we consider to be a nice part of this coverage, at least from an employer perspective. As I said before, there's no free lunch. We will have to have a discussion. We will need to collect some census information from the employer because we pre-populate the website so your employees don't have to enter a lot of information. All their specifics will already be there. But when it comes to communication and answering questions, et cetera, while we brand everything with the look of your institution, it will look and seem as if you were sending out the information to your employees. But we and the insurance company will actually take care of that communication. Everything will be approved by you, but we will take care of the information. And when people hit reply and when people call the numbers that are listed in the materials they receive, it will all point back to us, and we will have employees in our office that will handle all those questions. So we and the insurance companies will do the work.
Okay, we have another couple of questions here. Are there any participation requirements?
Yeah, I touched on that a little bit. So the answer is yes, there are participation requirements. Depending on the type of program we implement, one program has a twofold participation requirement. It requires either a minimum of 5 lives, it's the greater of 5 lives or 10% participation, 10% of the eligible group. The other program has a slightly higher participation requirement. It is a 20% participation we're looking for. But one of the concerns from a number of employers when it comes to participation is, well, we would like to roll this out. What happens if we don't meet the participation requirement? And if we are in that situation, it does not mean that the people who signed up are going to lose that coverage. They will still be able to keep the guaranteed issue coverage, even though we did not meet the participation requirement. It simply just means that we may not renew this particular offer for next year. So in other words, if the participation requirement is 20%, the insurance company may say, well, all right, we got 15%. It's not enough for us to spread the risk. So we will not offer this again next year. But again, you are not going to be left with egg on your face from a bunch of unhappy employees who said, I thought I was going to get this and now I can't because not enough people are signing up. That's not a situation you are going to end up in. Any other questions there?
Yeah, you might have already covered this, but it was typed in here. Can we cover new employees after the initial enrollment?
So the answer is to that is basically a yes. It does, as I just alluded to, depend a little bit on the participation requirement. But it is common for us to have these programs rolled out, and we kind of roughly know that we will, in most cases, meet the participation requirements. Certainly, if the employer plays along and allow us to send out the information as according to the timeline that we have established together. But let's say we roll this out for 1 year. You may have some new employees that are hired in the following year. And there may also, of course, let's say we ended up with 20% participation. That technically means that you had 80% people who did not decide to sign up. That insurance company will typically, in the following year, say, all right, well, we will do another enrollment. And during that second year, the people who has been hired in the meantime will be offered to enroll in this particular coverage. And the people who did not sign up during the first go-around will also be offered an opportunity to sign up a second time. And assuming enough participation is met, people who did not sign up the first year will actually have a third year where they will be given an opportunity to sign up alongside the newly hired employees, of course. So the answer is yes. People who are hired will have an opportunity to sign up, and people who did not sign up during the first batch of enrollments will have a couple of additional options to enroll, assuming participation requirements are met.
Okay, thank you. I don't believe I see any additional questions. Let me check here. I would like to remind everyone that we did record this presentation, and we are going to post it online, and I will send out a link to everyone who is registered. We'll also have a copy of Morton's presentation, which I will also send out to all registrants. Morton, do you have any closing comments before we end the webinar?
I do not, but I thank you all for participation or to staying with me during this. And of course, I hope you're all doing well and wish you good luck and good health in this crazy time we're living in. Thank you so much.
Thank you, Morton. That's Morton Sorensen of InsMed Insurance Agency Incorporated. And we're now going to close the webinar. Thank you, everyone, for attending today.
Thank you, Chris.
Thank you.